You talked about needing nurses in all the places that matter to create a culture of health. Putting that idea together with the recommendations, what do you see as the paramount opportunities coming out of this report and the paramount challenges? Because as George said so well, we need some changes in strategy to get to the goal.
Yeah. Well, first of all, I think Victor and George both highlighted some of the key gains that have that we've seen realized over the 5 years. The increase in educational attainment, huge strides towards the goals there, both in baccalaureate level, PhD, Doctor of Nursing. The fact that we have put together coalitions across 51 different locales. Just take a moment and think about how important that is. All of the progress that has been realized towards these recommendations really comes from the work of the people in this room and the fact that you've come together and created the kind of platform that will allow us to continue to move forward. So I said it during my remarks, I can't say it enough, thank you. That's really one of the huge gains so far. You've also seen gains in the scope of practice goals that we've set. I know that they aren't where we want them to be. They need to be further, but we have made progress there. And we've made progress in the diversity of the profession. We've got more that we need to do there, as we do with all of the professions. But I think that if we start with where there have been tremendous gains and the fact that you've got a platform for action going forward, that to me is the real celebratory message that should come out of this work.
Same question really to you, Victor, because as you said, the National Academy of Medicine you use the phrase curator of big ideas and pursuer of big audacious goals in medicine and health. What comes out of this for you,
Sure.
for the top goals for the Institute of Medicine, now National Academy of Medicine?
Well, first, let me say again, really how pleased I am to be here. Someone said to me, you're showing up a lot of nursing events. I say, that's the best thing. You invite me and I'll be there. I will also say, when I look at Risa's or Robert Wood-Johnson's Foundation's program, I told her it's really the most comprehensive program I've ever seen in really trying to address and tackle this big, big issue of health and well-being of our population. No question. And when you think about that and the implication on the economy and national security, it's the right thing to do. So thank you, really. Great leadership. And so as I think about this, I think we have lots of pieces in place. The question is, how do we get it to mobilize? And my feeling is, you know, these recommendations have a lot of different aspects, broader coalition. I think you need to get the patients and the community to really support this. A real grassroots feeling, because you work so closely with them, to recognize how much, in fact, you contribute to the health and how you're the effective arm of so many of the ideas. And I bet you if the common people is well educated about this and speak up, there will be tremendous momentum, I believe, from the grassroots. So in addition to coalition, I think a very important piece is the community. But I also think you need a seat at the table, if not the head of the table, right? I was just talking to Martha Hill about this. The fact that now more and more the students talk about we're training ourselves to be on boards and seats. Well, leadership is really, really important. So from the bottom up and from the top down, being able to drive the changes and be able to bring together. So a seat at the table, if not head at the table.
Great. Well, thank you. Well, I want to go back to the scope of practice issue that you just referenced, Risa. And again, talk about progress made, clearly, but challenges. As the report noted, 29 states, more than half, still have reduced or restricted practice authority for advanced practice registered nurses. Now, many of those are in the South, as we know, but there are also some very notable big states, New York, California, that fall into that category, which is frankly kind of shocking. You both have talked about building the coalition, and believe me, I'm enjoying asking this question of two physicians here. You talked about the need to really broaden the coalition, and as George and others said, that theme suffuses the report. You just mentioned bringing patients into this. Everybody remembers that horrible episode on The View a month or so ago, where it was clear that nobody understood that a nurse could hold a stethoscope. How do we get more people into this movement? Because as the report also noted, the coalitions and everybody has done a very good job of preaching to the choir for the last 5 years. It's now time to get out into a much bigger congregation and change some minds. So what's the way to do that?
Well, there are a lot of different ways, and probably the way that you need to do it in your individual coalition is going to vary a bit from others. So a lot of the solutions are local. But having said that, there's some things that we know we absolutely have to do. I think we have to always renew and refresh the information that people have about how important it is to work in teams, particularly now in the way we practice our clinical care. We know that when people cross professions, work in teams, they can achieve extraordinary outcomes. I am reminded of some of the outcomes that have happened at Cincinnati Children's Hospital, where you can get dramatic improvements in asthma care when you work as a team. And you could go on and on to come up with other examples. I'm sure you all have local examples. Renewing and refreshing that message is critically important because the public really doesn't understand that. And so I think that's a key part of it. Secondly, I think it's really important for us to understand that these changes in how we interact and the culture we create starts very early on, so that the emphasis that was given in the report about interprofessional education, the fact that we've got many more opportunities to do that at the undergraduate level in nursing now is great, but we've also got to do it at every stage of education. It's one of the reasons that the foundation has redesigned a lot of our leadership programs so that we are working across disciplines, across professions, and frankly, across sectors. So start early and often to build those messages. And then I think, importantly, at a local level, we've got to collect and aggregate information that tells the story, so that we've got the stories, but also an ongoing way of aggregating information that reinforces the importance of working in teams.
So Victor, it's the National Academy of Medicine. I'm happy to be a member, and many of the nurses in the audience are members. What's the National Academy of Medicine going to do to push forward on scope of practice now?
Okay. So let me perhaps give my own opinion.
No pressure.
No, you know. Certainly, I'll give you at least a sense of what I'm thinking. You know, we are an organization, have to be very careful not to be called political and advocate. But I'll say that if you look at this scope of practice issue, it's a policy issue to a large extent, but driven by data. What Risa is saying is absolutely correct. Get that information, show the evidence that, in fact, effective nurse practice in primary care, in hospital care, as the data that show that, you know, better outcomes, better education, that kind of stuff is very powerful for us to be able to make those kind of recommendations. So first, as been said, getting the data, doing the research, And I would say that, the time is so right for applying all different ways to support this research to demonstrate team-based work, nurse practice, advanced nurse practice, leadership, all this stuff. And that's really powerful. So that's number one. I also feel that time is really right because everybody's worried about cost of care. And who better know about cost of care or really in the front line than all of you? And in fact, when people argue, and I know this is a little controversial, when people say we don't have enough doctors, our report in GME says, let's find a solution for healthcare providers and not just increase the number of doctors, right? So the timing is great to make those arguments if the data is there to say, you know what, we're the ones that can do all those things, and there's no real issue about workforce issues, right? And I know I'm making it somewhat simplistic, but that's one way to look at it. That's when I believe that when you need to really work on policy issues and then find ways to work with the state government and even the federal government or CMS. My own feeling is that when I talk to our North Carolina state legislatures, they are talking about scope of practice. The senators are talking about this. Why? Because they know they're reaching a real challenge of having enough either physicians or the way which they can, if they expand Medicaid, how do we have enough providers? So I think that you have to find your way into those discussions, but with evidence, as you're saying, right? To make those arguments so that one can begin to see, because as you all know, many of these states are state-based decisions in terms of, the medical board. And I think there are certainly ways in which one can relook at some of these issues, but you need a kind of energy and data to help so.
Are we kidding ourselves that we still live in an era where evidence drives policy?
Well, all I can tell you...
Do we need something more?
Well, I'll give you an example. Tomorrow, we are celebrating 15 years of our report to Air is Human. Right? We have a big symposium that look at where we are, where we're going, and that was based on evidence of how many lives are being affected. And it's a wake-up call, but that was evidence. And yes, I do think so. I think still at the end of the day, I think we are very much dependent on evidence. Certainly our organization believes in it.
Well, let's go use that to springboard to this
Okay.
whole question about data, which again, you referenced, Risa. And as you pointed out, we just don't, we're collecting lots of bits of data. The report pointed this out. We don't have the National Workforce Commission up and running. Won't get that, speaking of evidence not driving policy. But how do we pull together these efforts that now are going on in siloed ways to really advance the data collection and potentially use it to influence policy?
I'm going to answer that, but I just can't resist your last question.
Okay.
I think that policy is always been driven by a combination of head and heart. And, sometimes we get the balance skewed in one direction or another, but if we don't have the evidence, and particularly a group like this, where we're trying to reach the best possible solutions for our population, we've got to have the evidence, but then it's incumbent upon us to figure out how to build the relationships that allow us to bring the heart in, to tell the story in a way that is compelling to people who will listen to the data once they have been engaged because of the emotional importance. So we've got to do both, and I think that that's one of the things that these coalitions have been so effective at doing. So keep doing that. In terms of the data and the question you directed to me specifically, we have, as a nation and really as a world, changed the way that we have the possibility of using data and information over the time period that this report came out. In 2010, we did not have the kind of access to information that we have now. And in every of these 51 areas that you all are working in, you're collecting information that is relevant to what's going on in your communities, in your state, and that is what is going to move the needle. One of the stories that really influenced me is a story that was told by a mayor who basically said to us as the foundation, if you can give me information related to my city that builds the case for fill in the blank, I can make that happen. It's local information. And we have access to local information from our hospitals, from the clinics, from our school districts, from the state nursing boards. The problem is we're not bringing it together and aggregating it in a way that it can be analyzed and turned into information that can actually move the needle. When you do that, it becomes incredibly powerful. So I'll just tell you the story that you all know about Jeff Brenner and what he was able to do in Camden by bringing data together across different hospitals to actually identify who were the high utilizers and identify some very simple interventions, some of them really involving, as you well know, nurses and nurse practitioners to bring down the utilization of emergency room and other preventable hospitalizations among a very vulnerable population. So I guess a long way of saying we've got to shift our thinking from these large-scale surveys, which are important, but where we may not be able to get as much traction as if we ask ourselves, what information is actually being collected in our local areas, and how can we be creative in bringing that together, analyzing it to make the case for the local policymakers who want that kind of information.
Susan, if I may, I think what you're asking me is something like this. If you have the data, do you have strong enough spokespeople and professionals to help you get the message across? So Risa's absolutely right. You need to bring both. I think it's insufficient in the health area just simply to make the argument. But boy, can we make those arguments well? We have the data with the right people doing it. And this coalition is very powerful. And getting people outside the profession to help is going to be very important.
Changing hearts and changing minds.
That's right, exactly.
At the same time. Well, another area, of course, that the report dealt with was diversity. And a clear recommendation that the campaign develop a comprehensive diversity plan with actionable steps by the action coalitions and other stakeholders. Ed Salzberg mentioned the notion of an annual report card to look at diversity. What specifically, let me start with you, Victor, on this one. As we know, the report also went on to talk about strengthening the academic pathways for nurses across the board at all levels. How do we put those two ideas together and attack this whole set of diversity issues from your perspective?
Yeah, I was talking to Lou Sullivan recently, and you all remember he wrote that report about, that the workforce in healthcare should reflect our population. And sadly, we're not there. And he's done it, I think, about 10 years ago, right? And so we have a long way to go. And I think that's what our report says, is basically making sure that you are actually aware but have plans to be implemented, and it starts from the very beginning. So there's no question, as been pointed out, Risa, the education piece, the ability to get people into the workforce, facilitating a pathway, enabling it to succeed. I think it really is a totality of all those things that you need to improve diversity.
And then again, is there a particular role for the National Academy of Medicine in this now?
Well, as I said, again, we always feel that, first of all, actually I had a great conversation with John Lumpkin this morning, that when we do a report, we now need to be sure we take it further than just simply a report. And you have shown, that is AARP and Robert Wood-Johnson, how professionally you can say, yeah, the recommendations are there, let's just make sure that we have actions. Now, we have some constraints as an advisor to a nation, to Congress, not seen as people who are advocates. That being said, there's a lot of room for us to work on this environment and work with other people, and being able to reach out to different universities and communities to talk about what we do and to encourage them to do what they do. So absolutely. So from our perspective, we will continue whatever evidence-based report we put out to put as far as possible, and let other people take over the implementation. Likewise, I think based on this, new questions arise, and many new questions arise, as you can see, and working with right partners, we can therefore take those questions and take it to the next level. I think that's the way that which we function.
Risa, same issue to you on diversity, both from the standpoint of the action coalitions, but also more broadly, thinking about how we continue to build these academic pathways that will, as was referenced earlier, looking at that pool of LPNs, LVNs, who could be moved forward into bigger and broader responsibilities and higher levels of education.
Well, as the report indicates, I think we've got to make sure that the linkages and the handoffs, if you will, are potentially as seamless as possible, so that as people want to take the educational achievements that they've gotten at a community college to the next level, they can do that without it being, onerous and difficult. That goes without saying, and I think people are engaged in trying to make that kind of transition happen. We clearly have to make sure we've got a faculty, whether it's the clinical faculty or the more basic science faculty in our nursing schools, that reflects the population as well, so that students who come to educational settings feel comfortable and ready to learn and engage. And we've been saying that as a group of professionals for a long time. I think the other thing that we've got to really emphasize going forward is getting younger people engaged at an earlier age. Investments in STEM are critical. Those investments in STEM that happen in secondary school and younger are things that, when you look at your coalitions across the states, are areas that you can advocate for that may not deliver this year or next year, but let's face it, folks, this is a long-term goal that we're working towards. So we've got to move it back to an earlier age. I think if many of you who are doing this or lifelong learners, if you think about when you started committing to this profession, it probably was, for many of you, in high school or maybe even younger. And that brings me to my final point, and this is going to, I know, seem very radical to you, but the data is compelling that investing in early education really makes a difference in not only educational achievement, but in life chances and opportunities over the lifetime. So if we're really thinking about how we're going to ensure that we not only have a diverse population of nurses, but also the best opportunity, I think we need to look at that complete chain of opportunity for our young people.
And would you see a role particularly for nursing in that, looking at that area of early education, early childhood education, or is that more of a societal function we need to step up on?
Well, both and. I go back to the point that Victor has made and that I made, that when you look at where nurses work, you're working in all the places that require change if we're going to move this agenda forward. And if you think about leadership in those areas, the opportunity to exert that leadership role is one that nurses have. We don't have to limit ourselves to within the healthcare environment.
Susan, if I may, I want to amplify what Risa said. I think one of the things that we need to think about, where certainly early education is so important. The question we should ask ourselves is, are we communicating effectively to a younger population? So it's fine to create pathways, and opportunities. But if we don't know how to talk to them and communicate with them, I had this recent discussion about physician scientists, the same issue. When people say, well, it's all about the money that they're not entering. I said, that's not true. If you look at a lot of our nurses, doctors, they know global health, they work for nothing, for, in areas of need and disparity, et cetera. So I think the question is how to message, in this case, health providers, in this case, nursing. How to make people to feel that they understand this is so important, this is what they want to do. And so that's another element, in addition to the kind of things we talked about. Certainly, you ask what IOM can do. Well, I think that providing the next level of thinking about what are the pathways and incentives, and how do you actually assure that you have enough nursing faculty. Certainly, when I was there, when I watched Duke, we have doubled our student enrollment, but we weren't able to find enough faculty, right? So a lot of people should also aspire to be in the education realm and the research realm with the number of doctorates that's coming out to really energize the field to be able to do that. And then on the diversity front, obviously embedding diversity into all these thinking.
So, Risa, you mentioned in your speech, sometimes when you use the phrase culture of health, you see people trying to parse what all of that means. And I suspect maybe some of that was even going on this morning. You mentioned some examples of nurses specifically engaged in what you described as a culture of health, whether it was Cynthia Parent and her work to get the smoking ban in place in New Orleans, or Jan Walker and Open Notes. How can a nurse in a critical care unit think of herself or himself today as engaged in the culture of health? Is this just for those in the public health sector, or are those in the hands-on delivery of day-to-day care? Can they also be effectuators of the culture of health?
Absolutely. One of the things that is so critical in the interaction that nurses have with patients, consumers, their communities, is the ability to influence how they see the patient in a critical care situation, sees the journey of getting better, and all of the determinants of that. If we expand beyond just the medical or the traditional health-related determinants, and include in that conversation the things that really do make a difference in whether or not a person is able to achieve the level of health that they want. And those are often the factors within their home, within their environment, within their workplace. And so just beginning to have that conversation is a key step. The other thing that I hope people would take away from my remarks is culture is about the immediate place that we are, where we work. So if you are a healthcare provider working in a healthcare setting, how you influence the factors that people bring into that conversation about improving the health of the people you're taking care of is critically important. Actually, Victor and I go way back to a time when we were both working in the same hospital. And I don't know if you remember this, Victor, but at the time in that hospital, which will remain nameless for now.
Aren't you just kind of visioning Grey's Anatomy with these two as two of the characters?
We were both a lot younger then. I was reflecting on where the what we call discharge planning was located at the time. And I don't know if you remember, Victor, but it was in the basement.
Yes.
Away from everything. And if that doesn't send a message about the importance of what happens once you leave the hospital and your ability to achieve the health status that you want, I don't think anything does. So being able to influence within your hospital, within your area, the things that are going to be given emphasis is very important, and that's where nurse leadership, both at the board level, in the C-suite, has such a tremendous importance for changing how we all think about improving health.
And Victor, a comparable question to you. The Academy has already put on a number of events around the culture of health, partnering with the foundation and others. Do you think the National Academy of Medicine is embracing now the culture of health and creating the kind of platform for these actions that we've been describing?
Well, that's what we're about. That's why we're so excited working with Risa, because it is about culture of health. And that question, which is a trick question about how do critical nurses get involved, it's really, to me, culture is the way of life. It's everywhere. There's no fixed place that you suddenly say is relevant. When you, as Risa said, in the critical care unit, well, if you bring all your values there and you interact with the patients, you're able to understand and help them think about their environment, which they're going to return to, and work with them. I think that's a critical part of what, as Risa said, culture of health, right? It's really everything that we do collectively. That's why her plan is so comprehensive. I mean, she has healthcare, health systems, all the community, civic engagement to, healthy lives and early childhood. I mean, I think that's what we do collectively. So in my feeling, it's not where you work, it's what you really bring with you to the place you work. And you influence, as Risa said, your work environment. You help the patient's family through a very difficult time in critical care, but you're also aware of where they're going to return to and how you're going to enable them to continue to function and improve their health. And certainly from the Academy, that's what we do. We're very, very lucky to be trusted by so many people that we ask to look at these issues. And as you know, we have forums, roundtables, constantly talk about health equity, many issues, helping us to think through this with your minds, and then being able to hone in areas that we feel we can make a difference, and then work on the deep dive, as you've seen in the area today.
In 5 years, presumably, there will be another report back saying what has been accomplished in the previous 5 years. If you had your druthers, both of you, what would be the top goal you would want to see that report reflect that had been accomplished? Or goals, if you can't, if it's like children, you don't have a favorite one, you have more than one. What would be on your list of the top?
Well, I guess, first of all, I would go back to why the future of nursing was such an important report when it was issued in 2010. And it's because we were thinking about what does it need to actually have patients, our communities, our nation be healthier. And so if I fast forward 5 years, I would want in all of these coalitions for there to really have been an embrace of some of the areas that you can take on to make us healthier, so that it's not going to be the same across the 51, but there would be tangible evidence that this platform had been used to not only advance nursing, but also to make that community a healthier community. And then secondly, I think we've got to look at what we've been saying is a critical issue, the diversity or inclusion of the profession, that we should be able to achieve measurable gains in the diversity of our profession. And again, that may be different in different locales, but let's set some goals and demonstrate that we've actually made progress that's measurable. And then I think the last is that there would be connected to these coalitions a way of measuring in an ongoing way our progress and feeding that information back. We've all said that there's a lack of data and information. Unless we are intentional about measuring it and putting that in place in all of our various 51 areas, I don't think we're going to accelerate to the degree. So those 3 areas, and I think if we can do that, each area will be even more awesome than you are right now.
Right.
Yeah.
And last word to you, Victor.
Well, I think there's no question we all want the same thing, which is a healthier society. So the number one goal, I would say, is measurable evidence that actually we've been able to move the needle. And that needle is, to a large part, also through this particular initiative. So that is, as Risa has said many times, we see you as the effector arm of the culture of health, and therefore be able to achieve it. Not the only one, to be sure, but an important one with evidence that through the action coalition and through the evidence you collect, that in fact that's going in the right direction, which will obviously enable further policy changes that can move everything in the right direction. I would also say that these things need to be going on and on and on, and not just a one-off, that in fact 5 years from now, we should be thinking about what we want to do next level and continue this kind of action approach. So, and of course, one important measurement, as Risa pointed out, as we've all said, is the workforce reflection of the people that we serve, the diversity.
Join me in thanking them for a terrific discussion.